Hi everybody, it's Dr. Joe and Carl, who decided to take a dip in the pond behind me before we started shooting. He probably will spend the majority of this video in his water because that's what he loves when it's hot outside. So enjoy that because I will afterwards. But today I want to talk to you a little bit about vaccine titers, and this actually kind of plays a little bit of a role in that as well. So vaccine titers is a blood test that checks the antibody levels for viruses that dogs can be exposed to in the wild. The most common that we test for in our clinic is canine distemper virus, canine parvovirus, and the canine adenovirus. Come here, buddy. What this is a simple blood test that we then send out to Kansas State University, and they give us a level of titers to tell me, are they protected against this virus or are they not? Meaning, if they were to be exposed to this virus in the wild per se, or in this crazy backyard, would they be able to mount a response so that their body does not develop the true disease and that they can rid the virus without becoming symptomatic? And the reason that we do this is that just so we don't over-vaccinate our dogs. But notice that I said that this is used to test for viruses, not bacteria. So standing water is a perfect breeding ground for leptospirosis, which is a bacteria that is spread through the urine of wildlife. So because Carl absolutely loves his water, he is vaccinated for leptospirosis. And so we do not yet have an antibody titer testing for this bacteria. Same with Bordetella or the kennel cough bacteria. So really the three main viruses that we test for is canine, come here, gross boy, canine parvovirus, canine distemper virus, and canine adenovirus. That is your DAP vaccine that your dogs get every 3 years from your veterinarian. So in lieu of getting that vaccine, you would do the titer test instead. Now, why would we even do a titer test in the first place? We just want to make sure we're not over-vaccinating our pets. And so the first dog that I would test is about a 2 or 3 year old dog who's coming due for their next vaccine. And we would do the blood test, make sure that those titers are protective levels. And then we would recheck it every year per the instructions of Kansas State University or Cornell or whatever veterinary lab you would send it out to. Now, what happens if they are not protected? At that point in time, we need to make sure that we boost their antibodies with vaccination. And that way, if they were to be exposed to the virus in the wild, they would not get this disease. So if your alternative vet is telling you to vaccinate your dog, vaccinate your dog. Now, one of the other things that we talk about a little bit in our clinic is the rabies virus. In the state of Ohio, there is no state law against or requiring you to vaccinate your dog against rabies. However, in 88 of the counties, it is required. And in several cities, they even have a rabies code that you have to have your dog vaccinated for rabies as well. So there is a titer test that you can do to check your dog to see, do they need to be vaccinated for rabies? And the reason rabies is such a big deal is because it's zoonotic, meaning it can be spread to people. And I've talked to the state vet in the state of Ohio. If your dog has a positive rabies titer, meaning that they are protected against the virus, and they were to bite somebody, in the state of Ohio, that they are considered non-vaccinated. So my recommendation, again, to my clients is go ahead and get your dog vaccinated. It's every 3 years. In the state of Ohio, the manufacturers will guarantee their vaccine for 3 years. And it really, over the lifetime of your pet, that's really not that many vaccines in order to keep yourself safe and to keep the community safe. So titer test your dogs when they are 2 to 3 years old, and then yearly thereafter, vaccinate when needed. Vaccinate for the rabies vaccine or the rabies virus. If your dog is exposed to standing water like Carl gets here in our farm, then go ahead and vaccinate him for the leptospirosis vaccine for the leptospirosis bacteria as well. And then as needed for Bordetella or canine influenza. One more thing I do want to mention about vaccines is that in order to have a protected vaccine titer, your dog has to have antibodies, which means they either have to have been exposed to the virus in the wild, which potentially would have led to the disease, or they need to be vaccinated. So I recommend that all dogs, all puppies, unless otherwise recommended by your primary veterinarian, get their 8, 12, and 16-week vaccines against the distemper parvo adenovirus, which usually includes the para-influenza vaccine as well. So again, alternative veterinarian here recommending 8, 12, and 16-week vaccines for your puppies to make sure that they don't end up a statistic and end up passing away from a disease that is almost 100% preventable. So if you have any questions or concerns about vaccine titers or any questions about Carl and his swimming pool, please let me know. You can email us at drjoepetvet@gmail.com or go ahead and drop us a question in the comments. Thanks so much. Bye. Here we go.